need, and that is what briefly I'm going to discuss about. And firstly, next, sorry. Just to tell about, I am mostly trying to restrict myself. Sorry, this is giving. Restrict myself on the kidney problem. I'm not going to go into the transplant of liver or heart or anything else. So let us concentrate only on kidney transplant. Definitely you would like to know why you are giving so much importance to kidney transplant. Firstly, you can see that as far as the Indian CKD registry, which was started in the year 2010, that you can say that about 160, this is not about 160 patients per million population develop kidney failure every year in the country. So if you calculate in that ratio, it comes to about 2 to 3 lakhs new patient per year who develop kidney transplant and need some sort of treatment to sustain their life. And what is the most important, that as you all know that India is becoming the diabetic capital of the world. Maybe in another less than a decade, we will be a leading country with maximum number of diabetics in the world. And here you can see that diabetes is becoming a number one, the cause for end-stage kidney failure. But that is why the control of diabetes is becoming very important if we want to prevent many of these patients developing terminal kidney failure. And of course the hypertension, and both are a lifestyle disease, what is called nowadays, both diabetes and hypertension. And to some extent both the diseases are preventable. So it is very important for us to realize that how important it is to prevent hypertension and diabetes so that they don't lead into the terminal kidney failure. And then the very tragic part of the whole thing is that you can see the last paragraph, that as per the Indian transplant registry, the majority of the patient, 90%, once they are diagnosed with terminal kidney failure, would die within a month of diagnosis because the renal replacement therapy, that is, whether it is dialysis or kidney transplant, is either not available or not affordable to many of the patients in the country. Next. This is just to show you that what are the different the indication of or different causes of kidney failure. And you can see that type 2 diabetes and hypertension is again occupying the major space in this particular field. Next. These are some of the minor things now, which were a very major problem at the beginning, but now they are not contributing too much, like polycystic kidney disease. It runs in the families, ultimately lead to the kidney failure. Next. And something like the untreated or undiagnosed bilateral kidney stone, leading to extensive damage to the kidney and then leading to kidney failure. And of course some congenital problem next, like reflux nephropathy, where many of you have been seeing regularly. And untreated reflux like this bilateral would definitely lead to the terminal kidney failure. These are some of the minor causes, which some of them are preventable and some of them are not preventable. But these are the causes of terminal kidney failure at present. Next. As you all know, there is nothing much to tell about. As I already said, that the treatment options in terminal kidney failure is very, very well established now. Firstly, we have dialysis here, hemodialysis. You have all seen it becoming known to even the remote village people know what is dialysis now, which was not true. And then, of course, another thing is the continuous ambulatory peritoneal dialysis, and what is called a CAPD with a cycler. So these are some of the options available to prolong their life, I would like to say, because they can never be normal and they will only sustain their life maybe for several years, or if maybe few months to few years in some of the patients. Next. But the most important treatment option for this type of people with terminal kidney failure is kidney transplantation. And why it is becoming acceptable? Because it gives a better quality of life. They are almost like a normal other people. They can lead a near normal life, except the fact that they have to regularly take their immunosuppressive drugs and will be under regular medical supervision. They have got increased longevity. Our own cities, we have got about 5 years survival, about more than 85 to 90% 5 years survival. I think that is quite good if you compare a patient without treatment for a terminal kidney failure. And lastly, of course, the cost, if you compare to maintain them on dialysis, transplant is, though the initial cost is little more, but subsequently the maintenance cost is quite less. So that the quality of life is better, it is less costly, and of course you can prolong their life. We have got patient who is 25, 26, 28 years post-transplant, which we did in 1980s. Even now they are maintaining a normal life. And this is of course the surgically what exactly we do in kidney transplant. I am not going to go into detail of that. Thanks. Next. If you, next one please. So we have got a huge number of patients now. If you look in the whole country figure, we need about 50,000 to 70,000 transplant per year in our country. But what is happening, we are doing only about 7,000 transplant. That means we are way behind what is the required rate in our own country. And it is not because that they don't need a transplant, they definitely need a transplant, but we have not been able to do it because of the multiple of reasons. Firstly, the patient may not be well educated to come to the transplant level, they may not know what is transplant. And of course, affordability is still, though it is less costly, but still a matter of concern for many patients to come to the hospital for a transplant. And lastly, the most important, that they don't have a suitable organ for transplant. There are many people who they come to us, but there is no suitable donor in the family. But we have no other choice except to let them die without any proper treatment. Next. This is way back in 1958, 54, sorry, when the world's first human successful kidney transplant was done in USA. And this is the team and this was a twin brothers. The twin brother is a donor, twin brother is a recipient. So this totally opened the eye because they realized after the transplant that earlier which was not successful in other donors like father, mother or brother, sister, which is not identical. Here they could find that there is no rejection in this particular patient. This patient in 1958 lived for about 16 years before he died of some other problem. So this opened the whole concept of transplant, that there is something called as immunological differences between the patient and the donor. That means once we know that they are immunologically different, they have to be given some immunosuppression to prolong the life of the transplanted kidney. But this patient, they could survive with minimal immunosuppression because they were identical twins. Of course, the surgeon, he was awarded a Nobel Prize for this particular type of surgery. He died in an air crash. And this is a picture of the first surgery done way back in 1958. Next. Now these are the source of organ. Where do you get the organs from? Firstly, the living related donor, somebody within the family, maybe the parents, the siblings, the children, even the grandparents are allowed nowadays. Living unrelated donor, a big controversial thing, I am not going to go about that. Emotionally related donor, like very close friend, even wife is considered as an emotionally related donor. Swap kidney donor is a new concept which is being accepted by the Indian Parliament. Here suppose I have a B group donor in the family, but my patient is A, I can exchange my kidney with the other family, within the family relation of course. So the exchange of kidney within the family is called a swap kidney. This is being allowed by the Indian government very recently. And of course lastly, the most important is the disease organ donation, which we are going to discuss mostly on this next. We have a very low organ donation rate in India. This is we are talking about organ donation after death. The most advanced in this, you can see this country like Spain, they have about 30 to 35 per million population organ donation. And if you compare a large country like India, our donation rate, it was about few years back, about 8 to 10 years back, was 0.05 per million population, almost like as if there is no donor in the country. Next. But if you look at the other side, Uh, and these are the ideal organ donors. What happened? About 120,000 people die in the Indian roads every year. And they die because of road traffic accident, two-wheeler, four-wheeler, three-wheeler, anything. And they are mostly die because of head injury or multiple injuries. They are not suffering from any disease. They are healthy people driving the vehicle on the road, and they made an accident and died. So they are the ideal organ donor, these 120,000 people per year. So on the one side, we have got death of 120,000 people dying every year on the Indian road. On the other side, our organ donation is lowest in the world. This is one of the highest in the world. I think next to China, we are the number 2 as far as the road traffic accident is concerned and death. And here you can see. And but what is happening last 5 to 10 years, particularly like states like Tamil Nadu, Andhra, both Andhra and Telangana now, Gujarat, and having the organ donation rate is much above the national average. We have crossed to about nearing 1, we are touching these 4 or 5 states. I think this is because of the government's initiatives taken here in Andhra Pradesh and Telangana, in Gujarat, in Maharashtra, in Tamil Nadu. The government is coming in a big way how to take organs so that those organs are very precious commodity for the people who are suffering, so that those organs are not wasted, they are given to somebody else so that they can get a new lease of life. Next. If you should see the transplant activity, I am talking mostly about the cadaver transplant. The activity is mostly limited to Maharashtra, Andhra, then Tamil Nadu, Karnataka and Gujarat, and this side to some extent, the Delhi and NCR, they are doing very little. But mostly it is limited to these south and southwestern countries. Next. These are some of the figures what we have seen. This Tamil Nadu is of course leading now with maximum number of organ donation after death. And this is of course little old one. Next one. And here you can see that we are at around, this is not a very serially little, but here we are doing much better than the rest of the country. And we are, Tamil Nadu has crossed 1 now. More than 1 donor per million population, that is their population calculation. Whereas others are slowly coming up. I think Andhra is coming up in a big way, and definitely we will be number 2 after Gujarat maybe. And other people are also trying across the country, and they are realizing that how important to popularize organ donation across the country. Even the Indian Parliament has recently passed a bill. They have modified the Human Organ Transplant Act, and there will be organ centers in selected cities in the country. And this becomes mandatory. I will come a little later. Next. Then why organ donation is so low? As you can see that our death rate is so high, 120,000. On the other hand, if you look at the organ donation, it's dismal. These are the main of some of the reasons, that lack of public awareness, that people is not aware that their organs can be donated after death. Slowly the awareness is coming, with lot of NGOs getting involved in propagating the message of organ donation. Slowly the awareness is coming. And lack of cooperation between various medical specialties. I think this is very important. Within ourselves, we have a lot of problems. The neurologist, plus the surgeon, plus the hospital management, their coordination is very much lacking. So unless the neurologist and neurosurgeon, they cooperate, a cadaver transplant program cannot be successful, because they are the person who have to declare him brain dead. And once they declare brain dead, then only we can proceed with cadaver donation and transplant. So once they don't involve, it becomes very difficult for us to go ahead with the transplant. Lack of infrastructure is slowly now things are changing. It is not true in Hyderabad. And lack of recognition and support to the donor family. This is still a major issue. And we have to encourage the people who have already donated. We have to respect their family. We have to call them. We have to give them a lot of importance. And a lot of support we need to give them, so that some people try to give them some insurance for the whole family. Some hospital give them proper treatment to the remaining member of the family without charging anything. Some government is also planning to give them some railway passes to travel across the country without paying anything. So these are some of the initiatives the government is going to take. Again, coming back, this is the first cadaver. It is very unfortunate that first cadaver in the country, the 2 organs came from USA. That is in 1975, when I was PGI. Professor Samuel Coons, he is an African American surgeon. He came to India with 2 kidneys from USA to transplant it here. 1 kidney he transplanted when I was in PGI Chandigarh, and another kidney he transplanted in a Mumbai hospital. So that was the beginning way back in 1975, that this man he did the first cadaver transplant in our country. Next. Human Organ Transplant Act, I think it is very important we all should know, because transplant is one activity which comes under the act of law. There are not many medical fields which the government has a control, but this is, the legal thing is very important. Why it is important? Because to stop commercial dealing in human organs. As you all may be knowing that a lot of scams used to happen earlier, now it is coming down. That human organ buying and selling is illegal as per the law is concerned. So neither anybody can buy nor anybody can sell any human organ, which was happening earlier. Even now this is happening in countries like Sri Lanka, some Philippines and other countries in China. But in India definitely drastically it has come down once they started, they promulgated the Human Organ Transplant Act in 1995. To regulate the organ transplant activity in the country, because we are accountable to the government. They must come and see, they come sometimes and see how many transplants we are doing, what is the outcome, how many patients getting the benefit. So this is under the Transplant Act. And lastly, more importantly, to encourage cadaver organ donation and transplantation. So that please, next please. The same thing was amended 2 years back, 2013. Earlier it was not mandatory that any patient dying in a hospital, he may be dying of a head injury or brain hemorrhage or anything, it was not mandatory to declare him brain dead. Somebody declared him brain dead and ultimately he died of cardiac death, and that is the end of the story. But now the government is mandatory as per the new Human Organ Transplant Act, which was amended in 2013, that every hospital must declare a brain death. If a person is brain dead, he must be declared as a brain dead. We cannot leave him like that. And once there is a brain death is declared, he is supposed to inform the central nodal agency. In Hyderabad, our nodal agency is located in Nizam Institute of Medical Sciences. So any brain dead patient in our hospital, suppose I work in KIMS, any brain dead patient we have, we immediately inform that there is a patient who is brain dead lying in our hospital. Once you declare him brain dead, this is a mandatory request for organ donation. Once you declared that our neurologist or neurosurgeon declares you are brain dead, it becomes mandatory for the hospital or the hospital transplant coordinator to talk to the family, to explain them what is brain dead, to explain them what is organ donation, and request for organ donation. So this is very important, that mandatory declaration of brain death, inform the central nodal agency, and then mandatory request for organ donation. Earlier the government was telling that only neurologist and neurophysician, neurosurgeon, they can only declare brain death. But now they have widened the space. Now they give even an intensivist, even an anesthetist, even a surgeon who is in that hospital, they can also declare the patient brain dead. Because there are many hospitals where there is no neurophysician, no neurosurgeon. Those organs should not go wasted. That is why the government said that even those doctors can declare him brain dead. And of course, they separate organ harvesting and organ transplant. Earlier, government recognized only transplant hospital. Now even the organ harvesting hospitals the government will recognize. Next. As far as the Andhra and Telangana is concerned, before the division, the Jivandan is an initiative of the United Andhra government. As I said already, the government has taken over the program, even in this part of the country. The Jivandan, the name they have given the Andhra Pradesh government, the program. And as per this program, all the brain death patient in any of the hospital has to be reported to the nodal agency, which is in NIMS, and they will allocate the organ. It doesn't mean that suppose in KIMS I have a patient, I will get all the organs. That is not true. The nodal agency is going to decide as per the waiting list who is waiting for the longest possible time, and those patients will be given the priority. We may give little priority, maybe suppose out of 2 kidneys, 1 kidney will come to KIMS, but the other kidney will go to the other hospital as per the rotational policy. Next.